But there was more. Teams began communicating progress results to other teams and throughout the workforce, and we began engaging them in the new process steps, which helped us to get to the accountability element. In addition, we were sharing team learnings with each other. One team, our strategic planning team, decided to process map our strategic planning process. When we were through, we had 18 feet of brown paper taped up to our walls. And there were about 6 or 7 different process steps that led to nowhere. It was as if they dropped off into a black hole. Once that team shared with the other teams the results of their process mapping, of course, no one else wanted to process map anything, but we did persevere and pushed on, and we kept learning. It was intimidating, but it was worth it. There were team successes, like our falls team. 4 years ago, our falls improvement team began working on ways to reduce patient falls. They started out by deciding that our target for our fall rate could never be 0, since we serve a frail and elderly population. Patients come to the hospital, and they're in an unfamiliar environment. The bed is different. The bathroom is in the wrong place. They are on different medications, and some of them are even attached to an IV pole, restricting their movement. There was no way that we could stop patient falls. This certainly does lead to disorientation and unsteadiness, and it was true, all of those factors, but we were using them as excuses. In the minds of our staff, it was inevitable that we would have some falls. But that didn't get us very far in our process improvement. But when we decided to revamp the team and get the frontline staff more active with the effort, we saw dramatic improvement in our fall rate. Once again, getting the right talent on the team helped us to see how we could improve our engagement. The staff who were dealing with the patient knew ways to help prevent falls, and they loved sharing those ideas. This improved accountability with our new process steps, because once we had an improved process that they had suggested that they would use to work their process, we were able to measure improved results. We're not yet at 0, but we definitely have staff who now believe it can be done. Another example is our ER expansion team. We have been working on expanding our ER for nearly 20 years. Some of our staff have heard about it for so long they didn't believe it when we said we were finally going to build a new ER. And in fact, some of them are still not quite sure it's real, even though they've moved in March. Our old ER was very crowded, outdated, and I have some photos to help tell the story. Staff stepped over each other all day long. Patients had the luxury of knowing that their privacy was protected thanks to the soundproof curtains we used to separate the gurneys. Processes were not customer-focused. They were staff-centric. In the old space, it was hard to make significant changes and then sustain the gains. Plus, staff were convinced that changing their processes would simply cause longer waits in the waiting room and thereby creating more patients who left without being seen. But when we opened our new space, we did not want to bring old, broken processes with us. It was an ideal time to make changes. A team was created among the ED staff to focus on improvements. They worked to educate the staff about the new space. They practiced the process changes in a mock setting. They learned how their conversations on stage and off stage would make a difference now that they would have a break room to go off stage for their rest breaks. The changes are dramatic. With only a few months of data available so far, the anecdotal indication is that our numbers of visits is up and sustaining, and our customer satisfaction has improved as well. In 2011, the ER patient satisfaction survey results showed only 3 out of 34 measures to be above average. Yes, we were that bad. We didn't even aspire to the 75th percentile, much less achieve national best practice. However, in the first 3 months of 2012, we have seen 75% of these measures already above average, and many of them are at the 75th percentile and climbing. Once again, the team was organized with the right talent. The efforts were made to engage the staff and to hold them accountable to the new steps, and the measures have showed strong improvement.